Hello everybody, I hope this video finds you well. For this specific video, I would like to discuss anxiety. Now, anxiety is something that we all have. It's more intense in some individuals than others. But anxiety, in the sense that we all have it, is basically referring to the fact that we do have some sort of level in it in order to help us survive as an organism. It's been developed since prehistoric times. It has to do with the fact that it's something meant to trigger and save you from a dangerous situation, to keep you alive essentially, to let you know that something is dangerous. But as we have evolved, things have changed. We have technological advances, we have advancements with homes, we have advancements with shelter, with defense. Things aren't necessarily so much of a hunting to gather, to constantly move around kind of mentality. It's a little bit more of everything's a little bit more stable, a little more developed, yet this part of us has not necessarily evolved. And in some of us, it doesn't evolve all the way. In some of us, it is there and it's underlying and it gets triggered by situations. It pops up randomly and it not necessarily has to have to do with an outdoor danger, but it's technically one that happens inside our heads and inside our emotions. So anxiety has 4 different kind of spectrums it can go into. So the first one is generalized anxiety disorder, where it is underlying, the person is typically anxious. It's a little bit more on the neurotic side. There are certain triggers to it. They're in general, they're a little bit more fearful with how they approach life, with how they approach situations and scenarios, and it causes people to be a little bit more cautious or a little hyper cautious in many instances. But I'll go into depth about those a little bit later. The other one is that when it actually develops and kind of brews up and boils at the surface for too long and isn't necessarily expressed and is a little bit more condensed to an event. So all of a sudden the person will be, relatively well, they'll be functioning well in everyday life. And there will just be this sudden moment of intense dread and fear. Then that is when the person who has anxiety is a little bit more into the spectrum of panic disorder. And then the other one that I would like to go over is phobias. Phobias are actually a form of an anxiety disorder, but that is a little bit more towards, it is like fears, we all have our fears of a spider or of heights because we know we could fall, but a phobia goes to the extent that it reaches an irrational level. It reaches a level that it causes immense fear in somebody, more so than just a survival tactic. It's an immense fear, such as someone being afraid of clowns or somebody being afraid of roller coasters, but not in the fear where like, oh my goodness, it's scary. No, it's like it paralyzes a person. It causes that freeze response in them. And the 4th kind of spectrum and path that it can go down is obsessive compulsive disorder. Obsessive compulsive disorder is known when those anxious behaviors and anxiety-fueled feelings are actually causing repetitive thoughts and compulsive behaviors throughout that daily life. And when these things escalate and when they get deprivating to the person's health or it interferes with their constant daily life, then that's when it's something that is a little worrisome. When it is a problem is when it interferes with the person's livelihood. And it may look invisible. A lot of people may not see when there is an individual having an anxiety episode, but it is very much real to the person experiencing it, no matter how big or small the situation is perceived by others. What happens specifically in the brain is that we have different structures within our brain, and one of the main ones is the whole limbic system within it. Limbic system is responsible for our emotions, and within the limbic system is the amygdala, which is the one responsible for the feeling of fear. And fear, while we do need to have it to a certain extent from our whole evolutionary process, we need to have it to keep us safe. It has been adapted. It has been an acquired characteristic that we needed to carry on with us as we evolved throughout time, but it just contains that little bit of fear to ensure that the person that the brain is living in is staying safe and keeping that organism alive. But when it comes to anxiety, that part is a little overactive because it goes hand in hand with this front part of your head, which is a brain structure called your prefrontal cortex. And your prefrontal cortex has to do with your judgment and decision making. So what actually happens is there is a certain exposure, there's a stimulus out there, it reaches the receiver or the person perceiving it, then all of a sudden that amygdala gets ignited and it gets overignited. And then on top of all, the prefrontal cortex has decreased blood flow. So their judgment and rational thinking part doesn't have enough blood flow. So whatever stressor is there cannot be necessarily rationalized to a calm manner that the person can be able to deal with, or that the average person would be able to just handle and rationalize through. It creates a sense of making a pebble-sized issue into a whole mountain because of those two exact things that start happening to the brain and within the brain chemistry. So it can be hereditary, and it can be developed through stressors in everyday life. It can be developed through environmental parts. It has many different routes that it can come from because of the fact that that already comes with us. The amygdala comes with every single person in the world. Whether the activation of it is too much, too little, or balanced is all within the individual. And it can be out of their control if it's genetic. But the ways of coping with it is there are many, many different ways. So if somebody wants to go to the clinical route to see a psychiatrist to perhaps get medicated, the medications that do help people with anxiety disorders is benzodiazepines, which block certain receptors in order to enable GABA receptors to get released, which helps a lot with reducing those anxiety-fueled feelings. It helps block the neurotransmitters that are overactive and allowing all the neurotransmitters that help a person cope with everyday stressors. If you want to go through therapy, the most effective one would be cognitive behavioral therapy or any other form of behavioral therapy. Because what also happens with that is it's not necessarily just an internal thought feeling. It's something that your thoughts are igniting your body to react a certain way. So in prehistoric times, a person is exposed to a mammoth or a saber-toothed tiger, and immediately they're going to either have a flight, fight, or freeze response. So they're going to freeze straight in their tracks, they're going to fight for their lives, or they're going to just run and try to get away from the situation itself. It causes a parasympathetic nervous system reaction. So your adrenal glands start pumping through your body, and it releases a lot of, norepinephrine, which has to do with your stress and has to do with all the cortisol levels that go through your body. But what happens is that now we're not necessarily confronted with saber-toothed tigers if you're living in a home, if you are in the modern day age, and if you're in a developed country. What happens is that instead of an external stressor coming at you, it's literally going to be your thoughts, your perceptions, the pressure you may feel from the outside world, but you're internalizing and switching it up to your perceptions and your belief system and your values. And therefore that can cause somebody to have a panic attack. That can cause somebody to feel extremely overwhelmed. And it can affect daily life. So behavioral therapy can be very effective because it addresses how your behaviors and how your expressions related to those emotions are panned out, and how to challenge those cognitions in order to match the behavior that you're having, or how to challenge those behaviors into matching a cognition that you need to have. So it will challenge, for example, if you have that fear, it'll challenge, well, then why are you withdrawing from people? And you say, because they're going to hate me. And that person will talk to you and be like, well, why do you think they hate you? And then it goes down to your cognitions. It goes down to your belief system about yourself. And throughout research and throughout personal experience from the moments that I have had elevated anxiety in me, it is induced by your thoughts. Your thoughts go in there and they sliver in there, and it gets blown out of proportion as soon as you take those thoughts as a truth. And that is another handy thing to do. But if you feel you can't do it alone and you need to seek a professional to cure this or to alleviate it or treat it, go down the cognitive behavioral route. It is strongly recommended. If you're not necessarily feeling ready to take those routes, or you feel that you would do better with a different type of treatment plan or your own holistic healing. Some people who have anxiety disorder go down a route where they decide to do something physical about their bodies in order to match that like adrenaline feeling that they're having inside of them that makes them feel on edge, in order to match that emotion and the activity. And that actually can be proven effective, because if you are feeling a certain way, or you know that you feel a certain way when you're stressed out, or when you're exposed to stressful situations, or just in general, maybe you overthink a lot, maybe you are pretty hard on yourself and you put a lot of pressure on yourself, and it becomes so overwhelming that you feel like you're about to burst or you're about to hyperventilate from all that pressure, it helps for the individual to get their body moving. Get your body moving to match your heart rate, because your heart rate is increased and your breathing is shallow and fast. So maybe try to trick your brain into telling it it's not in danger. You're not being chased by a mammoth right now. You're running, and you start running, or you go out for a run, you do a couple jumping jacks, you decide to get your body moving in a way that will match what your physiological state is, and that can actually clear your head. It has been proven effective for a lot of people as a coping mechanism, and I do recommend it as well, because it can trick your brain into not giving into that anxiety that just starts pounding at you. It can trick the brain into, okay, it's because I'm exercising, and it eventually alleviates, and that randomness of the occurrence can slowly diminish, because you're training your body how to cope with all that energy that's pent up inside you, and it's letting it be released rather than internalized and expressed as a panic attack at a very inappropriate moment that you don't want it to happen when you're in public or in a social gathering. It can be very effective in also releasing dopamine and endorphins that make you feel good. So you will start changing your brain chemistry by challenging it, maybe not necessarily getting rid of it so much right away, but you will be slowly putting in more good in your brain. More good neurotransmitters will be traveling through your neural pathways, and therefore your brain starts rewiring. So that's a very effective way too. For some temporary alleviating tactics to do whenever you have anxiety, I did post a video about breathing techniques that can help a lot when someone is experiencing an anxiety/panic disorder. But I know that it is not always very convenient to be able to flip through videos, so I'm just going to go over them briefly. The few breathing techniques you can have to alleviate it right away, let's say if you're having it, is the 4-7-8 rule. So what you do whenever you're feeling like that, and you continue these cycles until you feel that your heart rate is brought down and you feel in a much more calm state, and you can rate your anxiety at a lower scale than it was when you were initially feeling it at the onset. So with that one, you basically are going to inhale for 4 seconds through one nostril. You can do like a little hang loose sign. Close one nostril, inhale for 4 seconds. 1, 2, 3, 4. Hold for 1, 2, 3, 4, 5, 6, 7. Alternate. Push down the other nostril, and exhale for 1, 2, 3, 4, 5, 6, 7, 8. If you can do many cycles of that until you feel a little bit more alleviated, you will get into a better state, and you will calm your body down so your thoughts aren't so rapid, and you'll feel a lot better. Another one is body relaxation. So you can just close your eyes, you can sit down wherever you are, crisscross, and just start breathing deeply and breathing into different parts of your body and scanning your body like in an imaginary way, as if a light is scanning through your forehead, and it starts going down, and you start letting go of whatever tension you're having, because if you are stressed, your face and your body are going to react. Your muscles are going to tense up, your face is going to be worried, and just you're going to grit your teeth. So try to scan your body with an imaginary light and allow those muscles to relax as you breathe in and breathe out deeply and slowly until you feel that your body is at least surrendering and letting go of that stress. Another one that I even have a visual aid for would be to blow out the candles. So let's say you're feeling a little flustered, you're feeling a little overwhelmed, your heart rate's like, you can't get a grip, you feel like you're floating out of yourself. What you can do is, this is just for a visual aid. If you want to light candles, feel free to do so, just make sure you are safe. But for this example, I want to use a visual aid. So ask yourself when you're feeling like that, okay, how many birthday candles do I need to blow out? How many breaths do I need to take right now? How many deep breaths do I need to take? And you can visualize whatever it is that is bothering you in this candle. So I have 3 candles. So whatever is stressing you out, picture this candle. This is what's overwhelming you, okay? Try to get control of your breath. That one took a second hit. And then your second candle. Okay, I'm asking you, what is your second candle representing? What is your second prominent thought that's going on right now? Your worry. Breathe in. Let it go. Third candle. What is the third thing that is bothering you right now? What is overwhelming you? Picture it, visualize it, look into the candle, breathe in, breathe out. Just like that. You can either do it with the imagination of the candle, or you can actually physically light up candles, preferably some that are scented, because it will help ignite your sense of smell. And a lot of what helps with anxiety is to engage all 5 senses. So that's another one I would like to go over really quickly that I briefly mentioned in the other video, is while you're feeling like that, capture yourself. Breathe deeply. No matter how hard it is, try to get yourself there. Try to remember that you can breathe. You can control your breathing. So just go. Now list 5 things you can see around you in whatever space you're in. 4 things that you can touch. Touch 4 different things. Feel the textures, feel the surface, feel the temperature. Now think of 3 things that you can hear. Now 2 things that you can smell, and that'll be handy if you have candles around you. Now 1 thing you can taste, whether it be water, maybe you need a glass of water by you to help calm yourself down, or a specific little fruit that you can bite into to just try to bring yourself into the moment. Engage those 5 senses to bring you back into the present moment, because that can go hand in hand with a couple of different useful tools that I have encountered throughout my studies and throughout my personal experience with having anxiety. For example, there's this book by an author, well, 2 books technically. I'll discuss some books that have helped through this, and I know have helped others that have experienced anxiety disorder. If you're familiar with the author Eckhart Tolle, he is very well known for being somebody who has had experience in being an anxious person. He has had anxiety disorder up until, like he mentions in the story, in the book The Power of Now, and in the book A New Earth. He mentions that he had anxiety for 29 years of his life. He was always an anxious person, and then one day he broke down at nighttime and he couldn't live with himself anymore. And he kept telling himself that, but then it clicked in his head. He's like, wait, my and self are 2 separate things. How I am separate, like my consciousness is separate from my body. My consciousness is separate from the role that I am, even from my name. So it's about stepping outside of that, stepping outside of the situation a little bit, being a little bit within and without, and realizing that you are separate from those emotions. You are separate from that feeling. You are separate from the situation. And it's about also bringing yourself into the moment, because it is well known that anxiety typically is caused by a stressor, but also from somebody jumping 5 steps ahead into the future. It comes from creating scenarios in your head, or visualizing the worst possible scenario, or the worst outcome, or all the what ifs that can happen, all the things that you feel you need to prepare yourself for. Like, for example, with people that have social anxiety, they start thinking about what it's going to be like in that social situation, more so than just going with the punches. And it happens, it gets triggered, it gets ignited, but it is important to try to bring yourself into the present moment. And I think it's very handy to go off of somebody who has actually experienced it and who has fought through it and sought through it and gotten out of it. So those are a few helpful things for anxiety disorder and more information about it. Be kind to yourself if you're experiencing anxiety. You need to not be so hard on yourself. It comes a lot from putting this immense, overwhelming workload on yourself, and who you're supposed to be, how you're supposed to be, what you should be doing or what you should not be doing. So try to be easy on yourself. Try to calm yourself down with whatever techniques. Seek help if you desperately need it. Seek therapy if you need it. Try medication and see if it works for you. If your psychologist or medical professional diagnoses you with it or prescribes it to you. Try meditative techniques. Do the breathing techniques. Find out what works for you is what I'm trying to say, because we are not all a one-size-fits-all. We have different needs, we have different techniques and different ways of approaching life. So find out what works best for you and stick to it. And another thing, if you're watching this video because you have a loved one who experiences anxiety, I mean, thumbs up to you. Thank you for educating yourself more on this disorder. People with anxiety are going to simply be expressed and perceived by people who do not know about it. They're going to be perceived as self-pitying, or you're over-exaggerating, you're overreacting, you're thinking about it too much, don't overthink it, you're overwhelming yourself about it, that's not going to happen, or why are you crying, why are you angry, why are you scared, you shouldn't be scared, it's nothing big. But it's important for those of us who are trying to educate ourselves and destigmatize the mental health field and each other to be educated enough and compassionate enough to know that if somebody is acting a certain way, whether it's irritability or frustration or just being on edge, if that person has anxiety and is experiencing it, it's important for us to be patient, be calm, and do what we can to be there for them. And what helps a lot, whether you are experiencing it or not, is to let it be. You need to let yourself feel it. You need to find a way to cope with it after the fact. You need to talk to yourself kindly and carry on the tools every single day to help you get out of that until one day it's not such a big part of your life. It doesn't take so much control of you anymore. And it is possible. And remember not to be hard on yourself if you feel like you're taking 3 steps back. Or if some days you feel like, wow, I didn't do what I should have done, or I shouldn't have reacted that way, or I could have stopped myself from having that panic attack, or I could have stopped myself from overthinking so much. Instead, just be kind to yourself. Your growth process is not going to be linear. It's going to be zigzagged. You're going to take a step back. You're going to take 5 steps forward. You're going to take 4 back. You're going to take 3 steps forward. You're going to go to the right. You're going to go to the left. What matters is that you keep showing up every day and trying every day and being gentle to yourself and to others every day as they grow through this disorder and as they cure themselves of all the symptoms and all of the overwhelm that this disorder can put on a person. So please educate yourselves, forward this message along the way if you or someone you love has anxiety disorder, or simply share it so that way we can stop the stigma of mental health disorders, that we can stop the stigma of those that experience anxiety. And of course, feel free to revisit this video whenever you need to, and I hope you have a good mental health day. Thank you for watching.